today we're going to be changing a chest drainage system. So we've already checked our doctor's orders for the Ocean model, which is here. We've removed it from our package. Go ahead and wash my hands. So the next thing we're going to go ahead and do is fill the chambers. Chamber A is the suction chamber. So we take the rubber stopper off, and we're going to fill to the negative 20 cc line, or whatever the doctor has prescribed. Go ahead and put our stopper back on. The next chamber we're going to fill is chamber B. So here's our little cup. We're going to flip the switch side to side so that it's closed. We're going to fill it to the fill line at the top, which is 40 cc's. Okay. Then we're going to go ahead and open it up so that it drains into chamber B, which is the water seal chamber, and chamber C, which is the air leak chamber. So we open it up, and it should fill to the 2 cc line. So we can go ahead and remove the funnel. So now we're ready to go see our patient. First thing we want to go ahead and do is get a report from the nurse. So the nurse has stated that the patient does have a hemothorax as a result of a motor vehicle accident. The patient did give me the nurse gave me the patient's respirations, blood pressure, oxygen saturation, lung sounds, and pulse rate. So now we were going to go ahead and go in to change the patient's drainage system. Hello, Mr. Sumbum. My name is Aristea Cavazos. I will be your nurse today. Let me go ahead and get my medical record. Can you please tell me your name and date of birth? Yes, Mr. Sumbum, 12/3 of 75. Okay, do you have any pain right now? No, I don't. Okay, I've already washed my hands. Okay, first thing we want to go ahead and do is assess the site. So we'll put our gloves on. And what we're looking for is any drainage from the gauze. We also want to look at the centimeters where the chest tube is inserted. The nurse that reported off said that it was at 8 centimeters, so it's still at 8 centimeters, meaning the tube has not migrated off. I don't see any drainage. We just want to lightly palpate for crepitus, which he has none. Okay. For illustrative purposes, this is the patient's bed, and the table will be the floor. So we go ahead and pull out our old unit. And what we want to go ahead and do is have our new unit ready. The first thing we want to do is take the tape off of the old tube. We take the tape off the old tube. And then the next thing is to turn off our suction. So we went ahead and turned off our suction. To change the tube, we're going to go ahead and clamp this, or you can pinch. In this instance, we are going to clamp. So we clamp the tube, and we get the new tube, remove the cap. Don't want to touch the tip after you remove the cap. Since this is clamped, you want to go ahead and quickly remove the old tube and place the new tube in. Make sure you take your clamp off. Once your clamp is off, you want to go ahead and get your suction tubing from your old unit and place it on your new tubing. Then we go ahead and proceed to turn the suction on. So the patient's suction is on, and you can see that it's working. Expected findings in the air leak chamber will be tidally, which coincide with the patient's respirations as the patient is inhaling and exhaling. In chamber A, you will find some bubbling. So the last thing we want to do for this patient is to go ahead and tape his tubing again. We want to make sure that it is secure. So some some potential complications that may occur in a patient who has a chest tube. If the patient is being transported to X-ray, these chest tubes are portable. The machine would be hung underneath the bed. There is a potential that the chest tube may disconnect from the machine tube. In that instance, you want to have sterile water and a basin readily available. You pour sterile water into the basin and you want to dip the entire tube into the water so that it creates a water seal chamber. Another potential complication could be if the patient is repositioned or the patient turns a certain way, they may take out the chest tube. In this instance, it is an emergency. You do need to call the doctor right away. You want to readily have a 4x4 gauze, place it on the wound, and you want to tape it in three ways. You don't want to tape all 4 ways. You want to tape 3 ways. Another potential complication that may occur is pneumothorax. In the event of a pneumothorax, it is a medical emergency. You do need to call first response and notify the doctor right away. So this has been the demonstration of how to change a chest tube with the Ocean unit and what potential complications can be from a chest tube. Thank you.